Hello, good morning, everybody. Yeah, sorry. Thank you all for joining. There was a slight delay. We were sorting out the Zoom connectivity. So good morning, all. A very good, I think we have around 24 participants, which is quite good compared to what we had. So I'm Denny John. I work as a research methodologist with Center for Public Health Research. I'm also an adjunct professor with Ramaiah University of Applied Sciences. Today, the webinar is going to focus on the One Health in India. What are the challenges and opportunities? I have 4 speakers as part of this webinar, and I'll introduce each one of them as I go along. We have the first speaker as Dr.Omesh Bharti, who's principal with the State Institute of Health and Family Welfare in Himachal Pradesh. We have Dr. Chanchal Bhattacharya, who's currently working with the Animal Husbandry Department at Government of Delhi. We have Dr. Anil Kumar Sharma, who's working as a veterinary and field officer with Government of Himachal Pradesh. And finally, we have Dr. Ganesh Kondabattula, who's currently professor of practice with Ramaiah University of Applied Sciences. The webinar is aimed to bring, so I'll just start my presentation so that I hope all of you can see my screen. So I'll be focusing a little bit on what is just to start the discussion on what is the evidence and the economics of One Health in India. And I'll try to justify some of the work and lacuna that we have in terms of both economics and evidence regarding One Health in India. So one of the challenges that has been noticed in published literature is about the optimization of One Health implementation initiatives by providing grounded evidence that incorporates both theoretical issues as well as understanding of contextual influences. So this has been a very big challenge, and one of the identifiers has been like there is a dearth of evidence around what are the enablers and barriers for effective operationalization of One Health initiatives in India. And this paper by Asaga actually tries to highlight one of the challenges that happens if states do not see One Health as a priority as far as states are concerned. So the only reason that he says that if the center comes with funds and some guideline which is evidence informed, states are more than happy to follow them. So this seems to be kind of one of the realities around One Health, even if it means shifting focus from other level priorities. So I try to check what is the evidence around published studies in India regarding One Health, and I did a search using a very detailed PubMed query, and I used a very large kind of numbers in terms of the studies, in terms of trials or meta-analysis on any review or systematic review or randomized controlled trial, which are more relevant. So I tried to limit commentaries and other studies on the topic. So the first paper was published in 1996. However, by 2023, you notice that in PubMed, there's only 64 studies which are focusing on One Health or Zoonotic and India. And this was very alarming because if you do not have more evidence from a context such as India, which is wide diverse, and also in terms of the in terms of the reach, in terms of a lot of contextual understanding, and also understanding of burden of zoonotic diseases. There seems to be a huge dearth of evidence. I am sure that some of the other speakers will try to highlight it in their presentations about how do we bring more research into One Health, coming from different entities and specialities, right from, because One Health is an integration of interaction between human health, animal health, and plant health. So I think we need a lot of research that could be bring more evidence and contextual understanding on the topic as far as One Health or zoonotic disease are concerned in the country. The second point that is most important is also about the economic loss. And if you take the example of zoonotic diseases, the economic loss has been quite enormous. The 2003 bird flu H5N1 outbreak has almost exceeded 20 billion since 2003. In fact, East Asia and Canada, due to SARS, lost around $41.1 billion. And AMR, which is currently plaguing most countries, specifically in South Asia and Southeast Asia, because of rampant misuse of antibiotics in the region, it's expected that it might reduce the world GDP by almost 3.5% annually by 2050. So, however, there are estimates that while the return on investment seems to be very high, very good. So if there is an investment of almost 3 billion per year for operating and building One Health systems in developing countries, it would yield as much as 37 billion. So almost 10 times of savings from reduced pandemics, and almost a net win of $34 billion annually. So it seems to me, seems that the investment case for zoonotic diseases across India and other developing countries is enormous. It's almost 34 billion savings annually compared to the current scenario. So in terms of One Health economics, especially, it tries to provide countries like India with more options for choosing cost-effectiveness strategies, also to prepare, prevent, and respond to disease. We tried from our own, internal, as a supervision to a master's student, Dr. Abhishek Royal, who's currently working with WHO, and Omesh and me were working as guides. So based on his work, we managed to conduct a cost-effectiveness study around pre-exposure prophylaxis for rabies deaths in school children, under 5 children, and also a cost analysis of implementation. And based on our cost-effectiveness analysis, it clearly shows that we used our economic model using a decision tree, and the pre-exposure prophylaxis regimen seems to be cost-effective and life-saving strategy to avoid painful mortalities due to rabies in school-age children in India. And we also conducted a cost analysis of the implementation of a population-level rabies control program for children in India. And again, our study concluded that the intradermal route of vaccination and local infiltration of ERG in wounds only would be a cost-saving approach to prevent rabies deaths in children in situations where PEP-only strategies are implemented. So I would stop here. I don't want to take too much of time, and I just wanted to, bring forth Dr. Omesh Bharti as the first speaker. We are at 11:45, so we have time till 1 o'clock. So each of the speakers will be given 15 minutes for their presentation, and I'll be making a small either a hands up on the Zoom, or if physically Dr. Chanchal is here, so I'll be verbally telling him, or maybe he's writing a small note so that we can complete. The objective is all the 4 presenters make their presentation, and then in the end, we can have a question and answer session and also some responses from the participants, which are directed to any of the speakers. Thank you. Over to you, Dr. Omesh Bharti. Dr. Omesh, do you want us to share the presentation at our end, or would you like to share at your end? Dr. Omesh? On scene. It's just there. Yeah. Yeah, Dr. Omesh Bharti is facing some technical difficulties, so he'll be joining in 1 minute or 1 or 2 minutes. Kindly have patience till then. Thank you.
Good morning. Can you hear me? Hello.
Like
Hello.
to show the presentation at your end. We can give you.
Yeah.
You
You want to share? You can share.
Everybody is a host. Dr. Omesh Bharti, it would be better if you do the presentation.
Can you hear me?
We can hear you. Hello.
Yes, Dr. Sahab, you are audible.
You share the presentation, no problem. Your net is
okay.
Okay, thank you.
Yeah, make it full screen. Yeah, put that full screen and then make the screen, because otherwise it is going to show you. It depends on how what.
Can you put it full screen?
You have not put it as full screen. You're selecting the wrong window. You're selecting.
Can you put it full?
Is it visible, Dr. Omesh? Hello, Dr. Omesh, is it visible? Oh, is again gone off.
Not till now, not.
Sir, already we are sharing.
Maybe so many slides, maybe take some few minutes, few seconds. Yeah, now it's there. Yes, I can. Good morning. Can you hear me now?
Yeah, we can hear you.
Hello. Okay. So let us first of all, I thank Dr. Denny and his partners for organizing this very unique program and bringing experience, the One Health experience of low-cost prophylaxis for human beings in laboratories for rabies diagnosis between human and animals, rabies laboratories for human tuberculosis. And then we are collaborating with the Bongo University, UK on snake mapping in Himachal Pradesh and IC and also in the National Bird Study of Snake Bite Incidence. And then we are working with education departments on awareness of thalassemia, collaborating between health and education sectors to prevent thalassemia among the masses. So this is the framework we are working till now, and I will take one by one. Next. Hello. Next, please.
Wait. There is delay.
Hello.
Yeah, are you able to see the screen?
Yeah, now you can see. So as you all know, and starting with the rabies, pathophysiology of rabies is a virus that attaches with the nerve, and you can see 150 countries affecting animal rabies, not wildlife rabies. So all these need to be combined under one health. 30% of global deaths due to rabies are in India. So we need to have a low cost because the cost of prophylaxis is very high. Next. Next, please. Next. So many slides, please be first. So to begin with, we started looking for rabies in Shimla, and for that to the medical college, where we found 13 deaths due to rabies, and thereafter we tried to test animals, and we found these animals, Himalayan palm civet, dogs. Hello. Okay, now can you hear? अब ठीक है?
Yes, Dr. Sir, अब ठीक है.
Okay. Next slide, please. Next slide, please. Yeah, you can see this 2.5-month-old pup that was diagnosed as rabies, and Himalayan palm civet that was diagnosed as rabies. And this is a lady that has been bitten by a rabid dog and was given a low-cost prophylaxis that we developed in Himachal Pradesh for human beings, and she survived. Next. Yeah. So main strategy in low cost prophylaxis was pooling the patients and pooling the vaccine vials. So that's how we could bring down the cost of vaccine 5 times from 2,250 to 350 rupees per person. Next. So as the prophylaxis went up, being free to all, the rabies death came down. So that is the scenario in Himachal as far as rabies prophylaxis is concerned. Next. Yeah, next. This is a letter from Director Health Services to adopt new WHO guidelines on low-cost post-exposure prophylaxis for rabies prevention in Himachal. That has saved not only saved many vials of vaccine and immunoglobulin, but many lives, human lives also. Next. So we have adopted new guidelines of 3 injections on day 037 for post-exposure prophylaxis, along with only wound infiltration of immunoglobulins in human beings in Himachal Pradesh. That has brought death almost zero in the last, I would say, 10 years. Next. So you can see now very small amounts of average 0.5 ml of rig is required for wound infiltration in maximum patients in Himachal Pradesh. So data of 7,506 patients has been analyzed and published. Next. Thank you. So this is the publication. Wound-only injection of rabies immunoglobulin save lives and cost less than $1 per patient in Himachal Pradesh. Next. So currently 90 pooling centers are there where we are giving vaccine as well as immunoglobulins to the patients in Himachal Pradesh. Next. This is a video showing how we infiltrate small scratches, big wounds, and how we give intradermal vaccination. This video has been made by Dr. Anderson from Italy, who came to our clinic in Shimla and shooted this video, and this video is available on YouTube. Next. So again, another collaboration that is required from engineering students is that can a low-cost thermostable dissolvable intradermal microneedle rabies vaccine patch can be developed, and that can take the vaccine to village health centers. So that is another area where One Health approach is required to manufacture a thermostable, low-cost dissolvable intradermal microneedle rabies vaccine patch, so that vaccine can be delivered at the village health centers. Next. So you can see globally, when we shift from intramuscular to intradermal, we saved around $200 million per year on vaccine. Next. And we shift from intramuscular immunoglobulin to only wound infiltration of immunoglobulin, further $200 million are saved. Yes, next. Next, please. This is immunoglobulin that can be saved, $200 million per year. Next. So these are the rabies endemic areas where both human and animal rabies is a challenge, and we need to prioritize. Next. Yeah, these are the Delhi's lost. You can see rabies, a very important disease now, overshooting other tropical diseases. Next. $2 million Delhi's. Next. Annual human deaths from epidemic zoonosis, rabies is the leading cause. You can see then leishmaniasis, then Chagas and other Japanese encephalitis. So regarding these epidemic zoonotic diseases, rabies has now in the forefront and the highest death rate in the world. Next. 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 So you can see these vaccine preventable diseases. Rabies is now comparable to hepatitis in terms of vaccine preventable diseases. Next. This slide is from WHO, Katie Hampson. Next. So this what Denny said. No, this led us to do the cost effectiveness study by collaboration between different sectors, and now this study and some more studies next are a milestone in Government of India's decision to include rabies vaccine in UIP. So main evidence has been generated by these studies that we have done. As Denny told, we 3 people and roped in some other people. So now this recommendation has gone to Government of India to include rabies vaccine in UIP. Next. Next, please. Next, please. So this is another study. Next. So now rabies, you can see being spent on animal rabies prophylaxis globally, and that is increasing because dog bite is also increasing both in human beings and in animals. Next. So this scenario forces us to think of low cost solutions in animal vaccination also, like we have done in human beings, both in prophylaxis and post-exposure prophylaxis. Next. Next, please. Next, please. Next, please. Next, please. So this is the low-cost solution we applied on animals. With cows and buffaloes, we started intradermal vaccination like in human beings. That brought down cost of post-exposure prophylaxis to 5 times than the prevalent cost. And this is the publication. Next. Next, please. So this is the intradermal vaccination in cow, middle third of the neck. Next, please be first. This is in buffaloes. We are doing rig infiltration with insulin syringe that is saving the lives of these buffaloes bitten by rabid dogs. Next. This is a horse that is bitten by a paralytic rabid dog and was saved because of vaccination and local wound infiltration of immunoglobulins that was sought from a human dispensary. Again, how One Health can save the lives of the animals. So this life of this horse was saved from immunoglobulin sourced from primary health center. Next. This is a paralytic rabid dog that has bitten this horse. Next. Slow are next. So this is the slide Dr. Anil would show you. Dr. Anil is collaborating veterinary sector. So same intradermal we started in dogs also. Local wound infiltration of immunoglobulins for post-exposure prophylaxis that again brought down the cost and saved the lives of these dogs. Next. So these are the One Health approach, rabid dog biting dogs, and then some buffaloes and cows, and then some human beings also. All were given similar approach in vaccination, intradermal, and wound infiltration of immunoglobulins, and all survived. So this is a very good example of One Health saving lives in rabies, both of animals and human beings. Next. So these are the titers, repeat titers that were done, and all had more than 0.5, that is considered protective by this intradermal vaccination, and only wound infiltration of ERIC. Next. Next, please. Now we are collaborating with the NRC HISAR on PCR for rabies, and this is the first PCR on rabies they have done in collaboration with us. So, and it was found to be positive, and new tissue, new area was discovered for doing this PCR, which is highly sensitive from the muzzle area, from the nasolabial plate, and that paper has been published in PubMed indexed publication. Major work was done by Dr. Anil. He would show you. Next. Sometimes less can be more, like intradermal vaccination and local wound infiltration of immunoglobulins. So these are the first injection that we started giving to these school children in 2008. So our journey started on that day, 6/8/2008. Next. So now coming to zoonotic tuberculosis, we started talking of zoonotic tuberculosis when nobody was willing to take up this collaboration on One Health, and now we have reached a point where the government of India is also thinking of collaborating on zoonotic tuberculosis, human and animal sectors both. Next. This is a tuberculin test on buffalo. You can see the shaded area. Next. The lung of echo, you can see so many tubercles, typical tuberculosis, so many tubercles. And this is a study area, very few studies on tuberculosis, zoonotic tuberculosis has been done and compiled by. Next. Shirinidhi has done this meta-analysis on zoonotic tuberculosis in India. Next. So you can see the prevalence of bovine tuberculosis in India to be 7.3%. This study has been done, and you can see gaushalas are the main source. The stray animals are the main source. So we need to collaborate more on zoonotic tuberculosis. So this is again further data of snake bite in India. Again, because snake bites both human beings and animal beings. So we have some data of human beings, but there is no data of animal beings. So that is the gap where the veterinary sector need to come in and fill this gap of doing some animal studies or animal data collection, so that we know how many animals die due to snake bites in India. Next. So another collaboration, as I told you, with Bongor University to map the snakes of Himachal Pradesh. For the first time, we came out with pictures by catching these live snakes. And now we can say what are the venomous snakes in India and which are the non-venomous snakes in India. So these are the venomous snakes that are found in Himachal Pradesh. And this compilation was given to the forest department. For the first time, they know which are the snakes that are venomous and which are the snakes that are venomous, non-venomous in Himachal Pradesh. Next. We've also found some new species in Chamba that was named as Glodius chambensis. So these are the next non-venomous snakes. We have compiled a book on them. Next. So again, non-venomous snakes. We are trying to analyze their venom by titering it with the available antivenom, so to see how effective the antivenom is to neutralize the venom of these snakes found in Himachal Pradesh. And we have found that 40% of the venom is not being neutralized by the available antivenom in for the snake bites of Himachal Pradesh. Next. Again, this is a new Himalayan strip-necked identified after 100 years in Himachal Pradesh. Next. This again is species found in south. This wine snake has been found in Tattapani. So this is again a new discovery that we need to develop further on it. Next. So these are the guidelines, Government of India guidelines on snake bite management. So I am a part of these guidelines that has been framed throughout the country for the country. Next. This is the booklet we have compiled and published by Department of Forest on snakes in Himachal Pradesh and myths associated with the snake bite. So it's a very good book available on the ResearchGate and available with the Forest Department. Next. Again, a very good example of One Health collaboration. So this is our team, a very strong team from UK University, and some of two or three of us are from India. And this is the new, this is the species Central Asian cobra. You can see in the picture, which is one of the highly venomous snakes in the country. Whose venom is not being neutralized fully by the available antivenom. Next. So another One Health collaboration is ICAR Task Force Project Survey of Incidence, Mortality and Morbidity and Socioeconomic Burden of Snakebite in India. A study protocol. Dr. Denny is also a collaborator. Dr. Jaydeep Menon is leading the study, and by next year we will publish the actual results of this incidence of snakebite in India, which is for the first time in the country that we would know real-time data on snakebite incidence and deaths, mortality and morbidity, both, even socioeconomic burden also. Next. So coming to said we are collaborating with the students aware on thalassemia screening. So again, a milestone as far as One Health is concerned, because many sectors were involved in doing this study, including laboratories. Next. So now what is the way forward? So this we may be the first state in the country to adopt a state level genetic committee. So these committees are a collaboration of the system with the people who matter. So you can see the Secretary Health is the chairman, then mission director, then director health services, director medical education, director health safety regulation, director animal husbandry, director state veterinary laboratory, and then director CRI Kasoli. So you can see these such committees are a mandate of One Health from the Government of India. So there we are the first to make such committees, notify such committees that need to be done throughout the country by all the states. And very soon we are going to organize meetings of all these committee level. And is notification. Next. These are other members. You can read. No, so many. All the sectors are involved. Next. So this is the mandate. These are state level zoonotic committees to adopt One Health. Next. So Division of Zoonotic Diseases Program under NCDC has already given direction to form such committees in the country, and I would request all the participants to expedite the notifications of such committees throughout the country in different states. Next. So this is my appointment as a regional technical advisor on dog-mediated human rabies in Southeast Asia. I'm a part of WHO team on One Health, on zoonotic tuberculosis, on snake bite. Thanks to all the collaboration I'm getting from all of you and all of my friends. Thank you for all of you. Next. Next. Please. So these are my collaborators. Snakebite, I've already told you, and these are the other people from WHO, from Thailand. So all thanks to all the international collaborators, thanks to all the Indian collaborators, and thanks Dr. Denny for organizing this such a wonderful meeting and listening to me patiently, because it took a lot of time. Sorry for that long time. Thank you very much.
Thank you, Dr. Omesh. So what we'll do is, I think Dr. Omesh, I would request you to stay back because we'll take the questions or any comments from the participants after the presentations are over. So now I would like to request Dr. Chanchal Bhattacharya to come on board and speak about the One Health initiatives and his experience in the state of Delhi.
What is
Please hold on. There's some issue with the slide. Just give us a minute.
Presentation. First, you have to use your row arrow. This one. This will take you back. Will take you back. Please mute all of the other ones. Ida, are you okay? Then log off.
Yeah, can you listen me?
Just close that.
Hello. Yes, actually there is some technical issue, so we needed some more time. So myself, I am Dr. Chanchal Bhattacharya. I am working in Animal Husbandry Department as a Nodal Officer, Zoonotic and Infectious Diseases in Government of Delhi. And I have been involved in zoonotic disease management in the national capital of Delhi for a long time. So here today, I'm sharing some own experience and our departmental experience that how zoonosis and One Health approach is developed in Delhi, so that you can have an idea about the One Health approach in Delhi and India simultaneously. You see, in 2006, the first avian influenza outbreak took place in India. After that, Government of India, Department of Animal Husbandry, Dairying and Fisheries, they have directed all the state governments to prepare SOP. And it was a real challenge because at the time there were no informations about the avian influenza in literature. So almost from zero information, we started working on that, and we developed a SOP for Delhi state. Because you see, actually Delhi is the national capital, and all the embassies, UN offices, and a lot of multinational companies are based in Delhi. So SOP is absolutely required to inform the people how we are combating with the current scenario. Although there was no outbreak in Delhi, but a huge quantity of poultry birds were brought to Delhi each and every day for the consumption in local market for the Delhi people. So had to take some action and prepared SOP, and it was really difficult task, but somehow we did it. You see, we had undertaken a huge mass awareness program on TV, radio, and newspaper. We had gone to TV channels, then radio, and we started giving information as much as possible regarding the avian influenza. Although there was outbreak only in Maharashtra, but because in print media, there were a huge coverage. So we used to get a lot of phone calls. So the situation compelled us to open our control room with different telephone numbers. I was one of the in charge of one control room, so I got a lot of phone calls, queries from common people, from embassies, from different departments like this. Simultaneously, the foreign channels like German radio and television, then BBC, then Voice of America, they approached us, and we started giving them information about the avian influenza. And simultaneously, we assured all the people that there is no outbreak in Delhi, so there is no embargo on consuming poultry meat, egg, like this. You see, when the DIHDF had issued the guidelines to the state, then strict surveillance program was established in Delhi state. We used to go to the poultry market, collected samples from poultry market, basically cloacal samples and these droppings. Then we used to visit the backyard poultry where people are keeping backyard poultry, and we started collecting the feed sample, then cloacal sample, and the dropping samples also. You see, in Delhi, there are a lot of water bodies where migratory birds used to visit. So we had to collect environmental sample and water samples. We used to send it to RDDL, Jalandhar. In National Zoo Park in Delhi, a lot of migratory birds are coming from Mongolia, then Russia, then Siberia. So our RRT team has been established, and they started regularly visiting this zoo garden and collecting samples from the caged birds and the migratory birds also. There are different parks where water bodies are there under Municipal Corporation of Delhi, Delhi Development Authority, and NDMC, New Delhi Municipal Council. So regular visits are undertaken in these parks. Mostly ducks were kept there. So our team usually visit there and they collected samples and they collected information about the health of the ducks. Somehow we did not find any mortality at that time. We usually coordinate with NRDDL, Northern Regional Disease Diagnostic Laboratory under Ministry of Agriculture in Jalandhar, and we usually send all the samples to Jalandhar to get feedback whether there is any possibility of the outbreak or not. We have not found any positive samples from Jalandhar. Capacity building and regular training programs are organized by experts for the departmental vets and paravets, mostly from agriculture, Department of Animal Husbandry and Rearing. People came, people from WHO came also, and they organized proper investigative training program, how our vets and paravets will combat with the situation. And our government has sponsored our veterinarians, and they have been sent to Northern Regional Disease Diagnostic Laboratory in Jalandhar to undergo special training for avian influenza. You see, in Delhi, we have seen two major outbreaks in 2016 and 2020. In 2016, it was really a challenge because our department was not very prepared at the time. But very quickly, we have imposed quarantine on poultry market. We have totally closed the Ghazipur poultry market, where most of the poultry birds are coming from different parts of northern states. Then we established a RRT team for Ghazipur poultry market, from where regularly samples have been collected and sent to NRDDL. For the timing, the poultry meat and egg was banned in Delhi. No poultry bird and poultry products are allowed to bring in Delhi from neighboring states. Yes, that all the borders, all the entry points of Delhi have been closed at the time, mostly from where the poultry birds and poultry products are brought to Delhi. Parks with water bodies are closed for common people and visitor. Yes, and just like I'm mentioning that Hauj Khas Park, then Sanjay Lake. These parks are having big water bodies. We have totally closed all these parks for the visiting people. People who are walking there in morning, in evening, they were not allowed to enter into the park. And we have undertaken hygiene and sanitation measure throughout the park and throughout the water bodies, and strict vigilant measure were undertaken, so that if any ducks or any birds were found to be sick, then they had to be isolated and necessary action should be taken. National Zoo Garden was closed for indefinite period because we got indication that there are positive samples from the droppings. Then Lal Killa and other monuments are also closed for common public, because from some pigeons we got positive results. So we have requested the Archaeological Society of India, and they have closed these monuments. Regular visits and surveillance work are undertaken in Parliament, President Estate, Prime Minister's House. We have got some response from NDMC. There is a very big veterinary hospital under NDMC authority in Motibag. They were responsible for Prime Minister's House, Parliament House. So they got calls from PMO that some birds like crows or pigeons are dead in the vicinity of PM House. So immediate action had been taken. We have performed postmortem report. And the sample has been sent to Jalandhar. A gazette notification was made and monitoring committee was formed under the chief secretary. Yes, this is the first time when the multi-sectoral approach for control and containment zoonotic disease have been made in Delhi. Chief Secretary took a very serious view in this outbreak, and under the chairmanship of district magistrate in every district, there were a multi-sectoral team had been formed under the chairmanship of district magistrate and the medical authority, veterinary authority, environment and forest authority, PWD, Delhi police. All the stakeholders came under one umbrella and they started collaborating with each other. At that time, the concept of One Health has been developed in Delhi because everybody understood that a single department is not able to do all this hard work. So when the collaboration was started, then gradually the situation was improved in Delhi. Yes, another one thing is there, we have coordinated with our medical counterpart, medical department, and the veterinarians and paravets who are closely involved in surveillance work. They were properly screened by the medical team. They were taken the nasal sample, then swab sample, and the sample has been sent to laboratory to identify whether anybody is suffering from avian influenza. But fortunately, nobody was diagnosed as a positive in avian influenza. For 3 months, regular sampling surveillance undertaken by vets in poultry market, water bodies, parks, zoo garden, and monuments. Yes, actually under the guidelines of Government of India, at least for 3 months after getting a positive result, you have to undertake a surveillance work, and regularly you have to send the samples to Jalandhar or if required to Bhopal. So if the samples are negative, then only after 3 months, a notification has been issued that the area is disease-free. Even after Delhi declared as disease-free, viruses are present in the environment. In regular interval, crows, pigeons died. Yes, actually, this is a matter of concern for all the departments, especially the environment departments. When we have declared that there is no evidence of positive samples in poultry market or parks or zoo gardens, then also sometimes we have got news that there were dead crows or pigeons. When we took the carcass and collected samples, sometimes we got the result positive. Again, the exercise has been started and encircle the area and disinfection procedure has been undertaken. So it is a huge work. So what we have learned that when in commercial poultry market or when in the water bodies there are no virus, but there is a possibility that in environment the virus is present. This is a matter of concern. You see, our next One Health approach is glanders outbreak in 2015-16. You see, glanders is a disease of equine, and it is a zoonotic disease which can be transmitted to human being, and it is a quite dangerous disease, and it is used as a bioterrorism agent. You see, the bacteria is used as a bioterrorism agent, so it is a notifiable disease. When the disease outbreak took place in 2015 among the horses, so we sent the sample in National Research Center on Equine in with them. We invited a team of specialists from ICAR. They came here and they started collecting samples, and we found out that there were different pockets in Delhi where equines are positive. Actually, the guidelines are like this, that the equines who are showing positive result, they had to be euthanized. Here again, the One Health approach was established in Delhi, where Government of Delhi, then MCD, Municipal Council of Municipal Corporation of Delhi, then Delhi Police Authority have formed a special team under the chairmanship of district magistrate in every district, especially where the horses are found positive. The animal husbandry department team along with MCD team went there, and in some places they had to seek the help of Delhi police for law and order problem, because the horses have to be taken to a particular place for euthanizing them and burying them according to the guidelines of ministry and FAO. Sometimes we face huge problems because the owners were not ready to collaborate with our team. At the time, Delhi police intervened, and they have shown that already there is a gazette notification, and the horses have to be euthanized. So this is also a learning process for us, for our team, regarding One Health approach, how different departments are collaborating with each others. You see, a regular serosurveillance was conducted with the help of NRC, Equine, ICAR, HISAR in different places. Medical doctors from the medical department of Delhi government have visited the areas where horse owners were living. They have taken the blood sample from all the horse owners, and they sent the blood samples to the laboratory. And thankfully, no horse owners were clinically diagnosed as positive. These things have been undertaken as a Glender's operation. Now, if we are talking about rabies, Dr. Omesh, Bharti have already highlighted the most of the things about rabies. In Delhi, also rabies eradication program is going on. You see, ABC program has been started in Delhi long back. In 2004, a team of WHO, NCDC have demonstrated, you see, CNVR method. CNVR method is catch, neuter, vaccinate, and release. This is the same day method, but we have found out that it is not very suitable for Delhi stray dogs. So we have established 11 ABC centers in and around Delhi by the help of MCD, Municipal Corporation of Delhi, and the ABC centers were run by different NGOs. Delhi government is also a stakeholder of this ABC program. You see, in 2021, the NRCP, National Rabies Control Program, have been introduced by Ministry of Health and Family Welfare along with Ministry of Animal Husbandry. So right now, that direction to make Delhi rabies free within 2030. We have already prepared a state action plan draft proposal by the Animal Husbandry Department, and already we have submitted this proposal to National Center for Disease Control for further consideration and correction. Here we have suggested some stakeholder-based policies, how it will be implemented in Delhi. As an example, as a major stakeholder of this One Health policy of rabies eradication, Animal Husbandry Department, Government of Delhi, they are providing the dog vaccine from different veterinary hospitals and dispensaries, absolutely free of cost. Mostly, they are concentrating on pet animals and the community dogs. Okay. Here I am showing some horses who are found as a Glender's positives, so that you can have an idea. Thank you. I'm concluding my presentation here. If you have any question, we can have it after the show. Yeah.
Yeah, thank you, Dr. Chanchal Bhattacharya, for an insight on how Delhi state managed various One Health approaches to manage zoonotic diseases in the region. From government, we are now going to the field back. Dr. Anil Sharma is our next speaker. He is a field veterinary officer with the government of Himachal Pradesh, and Dr. Anil was briefly mentioned by Dr. Omesh as part of his presentation. So Dr. Sharma will provide us insights based on his field experiences on managing One Health in Himachal Pradesh. Over to you, Dr. Sharma.
Yes, I'll share my screen, sir. No? Is it visible to all?
नहीं लगा लो सर अभी थोड़ा सा पंगा
इसमें आ रहा है?
So is it visible? My screen is visible. Hello.
Yes, sir, it's visible.
So I would like to thank CPHR MANT, Dr. Denny, Dr. Nirmalya for inviting me today to talk on my field experiences with rabies management. As already Dr. Omesh Bharti has highlighted some of the points, I'll be discussing my field experiences with the rabies and its management. And it is a zoonotic disease, everybody knows, and it needs urgent One Health Connect. Rabies is 100% fatal zoonotic disease and is preventable through timely and adequate post-exposure prophylaxis. And rabies is caused by Lyssa virus and is known since last 4,000 years. It is a very long time, 4,000 years. Even in Vedas, its context is there by name of Hatami. So it is very old disease. It has two forms, furious form and paralytic form. Furious form, everybody know that dog gets furious, uncontrolled movements, hypersalivation, angry, biting tendency. But in paralytic form, these paralytic form of rabies dogs were reported to me. These are original photographs. In first figure 2, you can see wry neck. Neck is twisted towards one side, and jaw dropping is there in 2 dogs. You can see jaw dropping paralysis, and typical paralytic rabies cases these are. And in middle dog, black one, you can see lower jaw dropping is there. And figure 4, hypersalivation. All this liquid you can see in the picture is saliva. And hypersalivation, all 4 limbs paralyzed, and even conjunctivitis. And this conjunctivitis usually develops a sequel of meningitis in the dog. This is a very typical case of paralytic rabies in which dogs were taking food as well as water. So I want to clarify here that hydrophobia and aphasia is not the sign of rabies in dogs. Usually we have a misconception of mind ki agar rabies hai to pani nahi piyega. Even I have seen dogs drinking milk, drinking water. In this dog, ataxia was there, and the dog later developed all 4 limb paralysis. Now coming to some salient features. 99% of human rabies is caused due to dog bites and cat bites. 97% due to dogs, and 2% due to cats, and 1% due to wild animal bites. More than 95% of the world's fatal rabies occur in Africa and Asia. These are WOHA guidelines, and more than 80% of the rabies occur in rural areas and with limited or inexistent access to health education campaigns and post-bite treatment. And WHO says if 70% of the vaccination cover in an area for pet and as well as strays, it can prevent rabies in all human and animals as well as in wildlife. So human deaths, 59,000 annually. Human deaths are seen worldwide. Out of these 59,000, 20,000 deaths occur in India annually. About 30 to 60% of out of these 20,000, out of 30 to 60% occur in children below 15 years of age, as the bite in children goes unrecognized and unreported. Every 9 minutes, someone dies of rabies, even though it is completely preventable. In our country, rabies is mainly dog-mediated. As we have already discussed, it is 97% dog-mediated rabies, but it is not the matter to be dealt by a single department or NGO. So we all need to come in one platform and to execute this work of mass dog vaccination and deal with the rabies, having different approaches, post-exposure prophylaxis, etc. in a well-planned manner. We should come forward, and like previous two speakers, Dr. Omesh and Dr. Chanchal, spoke about intersectoral coordination. So if we want to control any such disease, which is zoonotic, we need intersectoral coordination. So prevention of rabies, what government is doing, considering the severity of the disease in India, and we need to prevent and control, leading to elimination of dog-mediated rabies by 2030. It's a mandate of government. So government launched in National Action Plan for Rabies Elimination on 28 September 2021. Earlier to launch NAPRE, several Indian cities had been taken up animal birth control, like Dr. Chanchal spoke about Delhi, ABCARV program with the purpose to reduce the number of dogs by employing a humane approach and in turn also reduce the number of rabies cases. But this has not been a sustainable program, because what is the main reason? It is with Animal Welfare Board of India. This is the main reason. Top 5 strategies being followed by us in Himachal Pradesh in collaboration with the health. Dr. Omesh, Bharti is one of my mentor, Dr. Shri Krishna Islu from the south, and even Dr. Denny. We all are coordinated. So mass dog vaccination and animal birth control. First strategy we are following is mass dog vaccination. And second is surveillance-based mass dog vaccination. Third is improvement in diagnostic approach for scaling up the surveillance. Number 4 is post-exposure prophylaxis in animals using intradermal route of vaccine administration and local wound infiltration with equine rabies immunoglobulins. Number 5, developing new tools to keep proper vaccination record and surveillance. To scale up the surveillance, we have developed some tools. First and best tool is mass dog vaccination. Those who are having little knowledge of rabies, everybody knows that 97% of the rabies is dog mediated, and if we are vaccinating even more than 70% of the dogs of that very area, that area becomes rabies free. So we need to focus on this very aspect with the keen interest in it. So vaccination of the source will be much more beneficial than dealing with the human deaths. 59 countries of the world has controlled rabies with the similar approach. So how we are doing this? Vaccination camps by Department of Animal Husbandry and Rampur Shahar in collaboration with Humane People NGO. There is one NGO we have framed, and I'm founder member of that NGO. And along with the local body, we have 2 types of approaches to vaccinate dogs. One is static point approach, one is campaign mode. So we whenever we have some static point or campaign, we put some posters like this on social media, on the page handle, on the government WhatsApp groups, so that everyone in that area gets to know कि vaccination इस area में होनी है. So these are some of the vaccination camps, pictures from the vaccination camps that we conducted in Himachal Pradesh in the rural areas. In my first very slide, I mentioned more than 80% of the rabies occur in rural areas. So they need to be made aware of the rabies. So we have some pamphlets in Hindi as well as in local language, so that everybody gets to know about the severity of the disease and how to manage the dog bite we are spreading. So ABC program, we are conducting animal birth control program, and we are doing post-operative care by these temporary shelter is being made here, and after that ABC surgery, the dog needs 5 to 6 days of proper care. After that, these dogs are being released into their natural niche. So we have a WBS data collection app along in collaboration with Mission Rabies. We have framed this app for our district Shimla. I am district nodal officer for Shimla for rabies surveillance. So we have these GIS based app. Every institution has been mapped in this app, and we have 3 forms added: rabies field report, vaccination, and ABC surgery form. So if we are using this type of tools, we can keep a proper record of it in a digital form, and we can have an in the end of month in an Excel sheet, we can have one monthly report, and it is easy to report also. So we have this app. This is for surgery ABC data. So very simple app. This is now second, and then other approach is surveillance-based mass dog vaccination, an effective approach to control rabies in hilly states like Himachal Pradesh, in addition to PEP in animal bite victims. Although WHO is not recommending PEP in animals, but in one of our study, we have seen 21 dogs were bitten and 2 human beings were bitten. So if we are not controlling rabies in the dogs level, so how we will be able to control this disease? As already I have mentioned, it is a 4,000-year-old disease. So if we are not checking the disease at the dog level, it will be for next 1 or 2,000 years more. Generations will go, but this virus will not. So in surveillance-based mass dog vaccination, in this study, we did proper surveillance in last 1 year. We reported 17 rabies cases, and in every case we checked the action taken by the in charge of that institution in Himachal. And in group A, if no action taken, in group B, post-exposure prophylaxis of the bitten and mass dog vaccination in 10 to 15 kilometer diameter of that area, and in group C, PEP along with mass dog vaccination, in group B, PEP only. So we checked the RVNA titers. In this study, we included 1,412 dogs. We did mass dog vaccination, and 845 dogs were injected by intradermal route, and 567 dogs were injected by intramuscular route. And local wound infiltration with ERIG was also done in category 3 bite victims. So proper bleb formation is there in intradermal and intramuscular in biceps femoris. The dose used was 5 times less in intradermal, 0.2. In near prescapular region, this is again one of the new thing we have seen. Dr. Omesh, Bharti, and I was discussing about how intradermal rabies vaccine works, and he told me if there is a cluster of lymph nodes, the vaccine delivery will be efficient. So I just conceived that if we give it near prescapular region, then it will be showing proper and high immunogenicity, and by doing rabies virus neutralization titers, RFFIT titers, it was astonished to our knowledge that it was showing high titers by intradermal route. This is one of our study, survival of 21 dogs after post-exposure prophylaxis using intradermal rabies vaccine in prescapular region, and emergency use of expired. Even we used expired equine rabies immunoglobulin because the immunoglobulin is having 300 IU per ml of strength, and we only need, there is one study, we only need 0.5 IU per ml to be as a protective titer. Even we tested this immunoglobulin after in the lab, in VOA reference lab, Dr. Stu's lab, and it was found to be 300 IU even after expiry. So we can even use expiry ERIC, or even we can dilute it by 50 times. We have diluted the ERIC by 50 times, which comes to be 6 IU, and even that gave the protective response, and all those animals, those were injected with the diluted rig were saved. This is again one of our study, pre-bite prophylaxis in dogs using single dose intradermal rabies vaccine. On day 0, 14 and 1 year, we did the RFFIT titers, serum titers, and we found that even after 1 year, 67% of the dogs were having this protective antibody titers. These are some of the titers that I have already discussed. Titers of mass dog vaccination, and these are the some from December 2021 till date rabies cases reported. So in the you can see in 4th number there was a case of rabies where no action was taken, and in this case one human death was there on 12th December 2023 even after PEP, and case of another rabid dog within 2 months. Within 2 months, you can see in number 8, 9 February 2023. It was after 2 months, another case of this rabies was there in Shimla region. And if no action is taken, there is a problem, and another case of the rabies will come within 10 to 3 months. It gets reported in dogs. And if there is a post-exposure prophylaxis of the bitten animals, or in bitten animals, if PEP, only PEP is followed, one case of rabies in dogs reported within 3 months also. This might be due to some of the bite victims goes unnoticed and unvaccinated, and no PEP, because it's also there in stray dogs also. So how we can recognize which one is has been contacted with the rabid dog or not? So if we are following only PEP, so this is not sufficient. We need to go with the post-exposure PEP with mass dog vaccination. In all the cases where we followed PEP along with the mass dog vaccination in 10 to 15 kilometers of that area from where the dog was reported, the surveillance was reported. So in that case, no rabies till date in the area. In all the 17 cases were there. So I have already discussed the results. So another approach is laboratory diagnosis of rabies by RT-PCR, by improving the diagnostics. In India, rabies is underreported disease, and its diagnosis is further hampered by the religious sentiments and affection towards cattle and dogs, respectively. That discourages the post-mortem examination. Sometimes we go and we try to convince the owner that iska post-mortem is very important, but owner do not allow us because of religious sentiments with his cow, or with the affection of with the dog, so they don't allow to perform post-mortem. So it's a very difficult task, because in this on brain tissue we need to collect. And in our recent study, what we did is we did nasolabial tissue specimens of post-mortem examination, and as the rabies virus, for example, in this picture you can see rabies virus descends centrifugally in the nasal planum using trigeminal branches, and virus replicates in the sensory corpuscles, intra-epithelial nerve endings, and squamous epithelial cells, cattle. So it travels centripetally from the bite side to the brain, and further centrifugally from the brain to the periphery. And it also includes from the brain to muzzle area, this nose area. In the center, there is nasal planum. From here, nasal planum, we collected this tissue, post-mortem tissue, and we did RT-PCR and LFA and DFA. So what is the reason for poor rabies surveillance? High biosecurity requirement, tedious procedure involved, owner does not allow postmortem, difficulty in transport and decapitation of head. These are some of the tests which we use for postmortem examination. RT-PCR, DFA, RFFIT.
Sharma?
Yeah, yes, sir.
Yeah, can we try to wrap it up because we have another speaker? We are already.
Yeah, sure. So here you see, in this case, I'll jump into the directly to the results. In this case, brain, muzzle, and nuchal biopsy all were found positive in PCR. Here you can see the clear bands showing rabies positive. Another case of PCR using nasolabial plate, it's a positive result. We did sequencing and we found it to be closely related to the Chinese variant, 99.91%, and it is the Arctic type of Arctic-like one virus. And we conclude that we know very less about rabies virus. During my field experiences, it was I was able to differentiate three different types of paralytic rabies in dogs. And usually, if you go to the Google and you see some of the articles, they'll say this furious rabies is more, but in my experience in the last 1 to 2 years, I have seen 13 dogs, rabid dogs, out of which 8 were found paralytic rabies and 5 were of furious form. So we know very less about this disease. We need to explore it more and more. And in different regions of Himachal Pradesh, we used technology, we used post-exposure prophylaxis, we used mass dog vaccination, and these approaches can control the disease if we come together in one platform. And this definitely needs One Health Connect, and we will be able to control this disease by 2030 only if we control the rabies at the dog's level, and that is the key for controlling the dog-mediated rabies by 2030. This is a picture from OIE reference laboratory where Dr. Shri Krishna Islur is the laboratory director, and under his guidance we are doing laboratory samples, and I'm grateful to him and Dr. Omesh, Bharti. Thank you so much.
Yeah, thank you, Dr. Anil, for that insight as a field practitioner in the state of Himachal Pradesh. Without taking much time, I would like to invite Dr. Ganesh Kondabattula to present on an immunological perspective of managing One Health in India. Dr. Ganesh, would you like to present from your side, or do you want us to present?
Yeah, if you the PPT you have, no, you can share it. Or if you want me to share, I can share it.
It would be better from your end, sir, if it's okay.
Okay. You had a modified anything. That's what I just wanted.
No, just minor modification.
Okay. You can present. You can share it, no, from your side.
Let me just check. There are some issues here. That's why I'm asking you to.
No. Otherwise, I am ready. No issues.
My suggestion is, sir, you present it at your end. This is not my laptop, so I'm not familiar how to get it.
Okay. You have to search.
Meanwhile, Dr. Anil, there is a question from Seethal Dalai that what are the challenges during these initiatives and collaborations, and are there any inputs into future sustainability of these collaborations? So, meanwhile, Dr. Ganesh uploads this presentation. Would you like to respond to that?
Yeah. What are the challenges we face during this intersectoral collaboration? No? This is the question.
Yes.
Actually, if you want to do something in your area, you need to take the lead. Put the challenges behind. First, you need to take the lead. I myself in this area, we founded an NGO. And there was no NGO. And your work will speak one day and you will be recognized, and people from other end will come to collaborate. So this is the only thing I can say. And in the government sector also, as Dr. Omesh Bharti has spoken earlier, there is a government notification in Himachal Pradesh now for this intersector and One Health collaboration. Those things are another aspect. But in the grassroots level, how you will manage, this is your capability. So you need to take the initiatives like this, and you need to identify the people who can definitely come forward and work with you. So there are a lot of challenges in field. As I earlier mentioned, this rabies is already 4,000-year-old disease. So if we need to control it, we need such type of initiatives in every corner of India. If we want to if we really want to control it from India, we need such a type of initiatives all around the India, in every corner. Thank you.
Yeah, good
Thank you, Dr.
afternoon.
Anil. Yeah, over to you, Dr. Ganesh.
Yeah, good afternoon, one and all. And this is my webinar. Topic is on immunological argument for One Health in India. I'm Dr. Ganesh Kondabattula, presently working with Ramaiah of University of Applied Sciences, Bengaluru. And I'm thankful to the organizers and Dr. Krishnamurthy Jayanna and Dr. Denny for providing me the opportunity. Here I will be presenting related to the topic which is assigned. Here I'm just showing the slide where One Health approach, as you all know, and now you are all experts in One Health. The coordination and communication and collaboration, these are the 3 points, as previous speakers also emphasizing. Coordination and collaboration and communication, these are the 3 things which are very essential to achieve One Health approach successful in India. So One Health integrates human and animal and environmental health. And it's a promising framework in India because we have a diverse wildlife population. Similarly, we have largest livestock populations, and we have high density human population, which are the challenges to work with One Health approach. One Health, it is as I already told, it is an integrated approach which recognizes the interconnectedness of human and animal and environmental health. So this will be addressing the health threats at their start level, before actually the outbreaks occur. So if you work in One Health approach, that is an advantage. Before actually outbreaks comes, we can have the outbreaks prevented. And the third point is collaboration. One Health relies on collaboration across the disciplines and sectors to achieve better outcome for all. The current state of zoonotic diseases in India, as it's already discussed, that dog rabies and the issues. But we have many things to contribute. I mean, many animals and the environmental factors which contribute the disease. Like bats, they are continuously harboring the viruses from natural. They are the natural hosts. Then the mosquitoes, and then rats. Mosquitoes, they are continue to affect millions of people every year in India. And the same case with the rats, they will be transmitting the leptospirosis and other disease plague with their contact and the bites. Here I'm just showing you the slide where I have listed the major zoonotic diseases in India. As per their occurrence, if I'm wrong somewhere, you can correct. There are a lot of rabies experts are here. So rabies and then brucellosis, they are the major diseases which we come across in the zoonotic important. And other diseases also I listed here, avian influenza and other diseases. When we talk about working with the cattle and cow, we have a lot of zoonotic diseases which are very important, particularly tuberculosis, which was already mentioned by Omesh, Bharti, and then brucellosis, rabies, anthrax. These are the few diseases I mentioned here. Overview of One Health situation in India. India has made a lot of progress by incorporating One Health approach in policy and practice, but there are still significant challenges are there. Particularly, we work in isolation and limiting the cross-sectional collaboration, and shortage of trained manpower, particularly with interdisciplinary knowledge, is not available for a collaboration. Particularly, they can work in isolation, but when it comes for collaboration, we will be poor people. So India has a potential to become a leader in One Health if these barriers are overcome. We need a collaboration between government, academic, and industry and civil societies for better response for the One Health program. So in the One Health program, we have different sectors to collaborate. That is human health sector, animal health sector, and environmental health sector. In human health sector, prevention and treatment of infectious disease, that is the primary job. The next is occupational health. So where we can also approach for occupational health. And then public health education, that is also an important area. In animal health sector, we have the surveillance of animal diseases, and then the next area to work is antimicrobial resistance and food safety and hygiene. In the environmental health sector, we need to work with biodiversity conservation and then adapting the climate changes and waste management. These are the important areas where we need collaboration. Immunological perspectives on One Health. These are the points where we need to stress. One is host pathogen interactions. The second one is vaccine development and microbial diversity. So when you talk about the immunology in One Health, it is a comparative immunology, which is more useful. In the sense, immunology, as you know, it's a science that deals with the immune system and cell-mediated humoral immunity and the immune responses. So comparative immunology, actually, it gives the similarities and differences in the immune system across the species. It will identify the shared immune pathways and mechanisms, which will be helpful to have a broad spectrum therapeutics and vaccines. So if you develop preventive measures and treatments by understanding the immune mechanisms, that will be very useful to work across the species. That is, multiple species we can work with the for the health of multiple species we can work. Environmental impact on health. So here, environment plays a crucial role shaping the immune system, overall health of the humans and animals also. In the environment, we have different factors like pollution, climate change, and the habitat destruction. These are the factors which contribute the environment. You know very well, if the air pollution is increased, respiratory infections are more in the humans and animals also. So One Health approach thus highlights the importance of safeguarding the environment first and maintain the healthy environment, which can give the resilience to all the species from the infectious diseases. One Health benefits are listed here. So One Health, it's a if you approach properly, it can prevent the zoonotic diseases and pandemics and improves the food safety and security, sustainable use of resources. And examples are in the literature. I could see that Ebola through vaccination of gorillas. Of course, in our Indian examples also, we have across the species, we have used the like rabies vaccine also. We are using both the animal and human cases. Similarly, if there is an example of limiting the antibiotic use in the animal feed, which can control the antibiotic resistance, conserving the wildlife populations by improving the habitat management. Here, I mean habitat management means we have to allow the animals to live in the wildlife there itself. Suppose if you are occupying their habitat and then the animals will migrate to different, you have seen the example of monkeys coming to the civilized places and creating the problems. So the challenges are here. There are challenges like interdisciplinary collaboration and policy coordination between the sectors, public education and awareness. These are the challenges we are facing. Benefits of adopting One Health approach in India, there are number of benefits, like the one is improved surveillance. We will have increased economic growth and better environmental management. So improved surveillance, it enables earlier detection of controlling the earlier detection and better controlling the outbreaks. And then the increased economic growth, because we have increased the food safety and security, that will benefit the exports and tourism. Better environment management by natural, using the better management of natural resources and conserving the diversity. There are barriers for implementing One Health in India. The first and foremost is funding resources. Funding resources constraints, and the second one is cultural attitudes. So if we collaborate across the sectors, the funding can be managed with a small, less number of funds. We can manage the difficult issues. Cultural attitudes, the perceptions about the roles and importance of animals between the religions and cultures, that will, affect the One Health efforts. Call to action for One Health in India. One is the environmental responsibility, where the impact of human activity, it will affect the overall well-being of the system, One Health system. Like if you plant a good number of trees, that will have better impact on the health of the people. Similarly, cross-sectional collaboration, breaking the silos between the sectors and collaborating across the sectors, that will help. And One Health awareness, raising awareness about the interconnectedness of human, animal, environmental health, that will be very useful, having a society, healthy society. So challenges I already told: lack of inter-agency collaboration, public awareness, and limiting the research funding, shortage of interdisciplinary professionals. Proposed strategies to improve One Health in India. The first one is we can increase the education and training in One Health aspect, so that the people will get the trained manpower, and that's a type of investment we can for having an interdisciplinary like One Health approach. Then comes the research funding. Allocating more funds to research, that will be a very essential thing, which will incentivize the collaborative research also. And One Health task forces we can create by policy, and then coordinating between the sectors. That is an essential thing. Then public awareness campaigns. Public should know what is the benefit of One Health. So that is the what required. So in conclusion, and I have some points to say for future direction also. Like we are working in isolation in some laboratories and some national laboratories and some government of India bodies. But what I feel is we should work for adopting one village or a group of villages to have the One Health approach from everyone. Like all the sectors which are involved in One Health, they should be working towards that village or group of villages, so that we are declaring those areas free of diseases and other health problems. So we can work till we are satisfied. If you have taken and adopted one village, we can assure the health of the people there. And then see, input of knowledge is more important than the inputs itself. Because when we go for One Health approach as a group or group of villages, because I had an experience of working with MG Meragaon program, where the people will ask, what is your input, what you are giving to me today? So we have to make them to understand knowledge which can help in the practicing the principles of hygiene and health and nature protection. They will be useful. And we need to collaborate between the medical, veterinary institutions and official bodies, forest departments and other bodies. So like we can address the root cause of the disease of emergence and transmission, through which collaboration and interdisciplinary research is possible, which can lead to safer and healthier and more sustainable societies in India and beyond. So overall, I can say embracing immunology into One Health approach, there are several benefits. Comprehensive immune surveillance we can have, and control measures with better diagnostics, we can manage the diseases. And understanding immunological aspects of these diseases for developing effective preventive strategies of the like vaccines and diagnostics. And we can also manage antimicrobial resistance with a understanding how the resistance is developed and how we can get a protection between from the resistant bacteria. Similarly, environmental impact also can be studied by immunological approaches. And we can promote effective vaccination strategies. And we can have the enhanced preparedness for tackling the emerging infectious diseases, ultimately leading to better health. So this overall, we should build a stronger partnerships among the stakeholders involving human, animal, and environmental health. And these practices in various sectors will push towards the One Health approach. So these are the few references I have put here. So thank you for your patient listening, and let us work together for our One Health approach. And thank you.
You understand very good physiology and biology. Yes. Depending on again.
I have done my talk.
Thank you, Dr. Ganesh. One minute.
There is some
Please,
crosstalk going on.
request, somebody is speaking, can you put your phone or laptop on mute?
Yeah, once we understand this physiology and biology, we give you the best of the best.
So if you have anything to discuss, I am available.
Medicine.
Not कहाँ से आ रहा है ये बाहर से आ रहा है या
वही ऑन कर रहा है पार्टिसिपेंट जो है वो कर रखा है.
Can I request all participants to please put your phone on mute?
So we have to understand. Nothing is separate.
Everybody is on mute.
There are specialized. In the cases there is one being. Oh, neurophysiology are in top differently, neurovision, psychiatry, psychology.
कहाँ से आ रहा है?
Different branches they will talk with me.
सब लोग तो mute.
Not
Sorry, I think one of the participants was, we had to mute it at this stage. So my question, so I would like to ask if the participants have any questions to ask to the, unfortunately, Dr. Omesh Bharti has left. I think he is having some technical issues. But since all the other speakers are there, one Veena Kamath is asking, what is the solution for stray dogs? Probably I'll go to Dr. Chanchal Bhattacharya also, because this is something like a state problem as well. And probably Dr. Anil, you can speak about some field experience.
Yes, actually, regarding stray dogs, it is really a headache for us right now. We need a sustainable approach, and we require a one-health approach when already the WHO has categorized that if you are not achieving to vaccinate and neutering 70% of the dogs simultaneously for 5 years, then you cannot reduce the number of dogs in a particular area. But unfortunately, Dr. Anil Sharma has already mentioned that in our ABC program, in our animal birth control program, sometimes due to some constraint, we are not able to achieve this target. You see, maybe in this year we have achieved 70%, but in the next year we are not able to achieve. So the total impact of this ABC program is not that much right now. So if we rethink about the ABC program, how we are making the ABC program more acceptable and more approachable, I believe that it will be better. It will be a better option for managing the stray dog population. And Dr. Omesh Sharma is here. Sharma will guide us in a proper manner, I believe.
So, Dr. Anil, do you want to speak about some field experiences of the stray dogs from Himachal?
Yes, sir. So actually, what I feel is for its sustenance, we need a lot of funding. Funding is the main problem in field conditions I am facing. Actually, we get exhausted with our resources, but we don't get exhausted with these dogs. There is no problem of catching the dogs. We can find the people who can catch the dogs. There is no problem of the facilities. But in rural areas, we have limited veterinary facilities for such ABC. And Himachal Pradesh, talking about Himachal Pradesh, our Himachal is 89.9% rural. So achieving 90% of the ABC is the target, and 70% of the vaccination. Then only we can control the rabies. But for as I earlier mentioned, this ABC is with Animal Welfare Board of India, and they are having the funds. They give the funds to the State Animal Welfare Board of the India, and they distribute the funds to respective veterinary institutions. And but the actual fund which we receive in the grassroots level is not sufficient to that area, and we get exhausted with that those logistics we require. So for making it sustainable program and making it a successful program, we need a huge amount of funds. And what I personally feel कि इसको National Health Mission के under डाल दो ABC को. If we really want it to be successful, it need a strong governing body, which I feel Animal Welfare Board is not a strong governing body. This is how we can control and we can have successful ABC in our country. Thank you.
Thank you, Dr. Anil. I think this question, probably Dr. Omesh, you're the best person to answer. There is Dr. Sudarshan who's asking, what is the rationale of 70% vaccination in dogs for 5 years reduces rabies? Is there any concept of herd immunity for the above statement? Your response?
Definitely, there is a concept of herd immunity, and barrier is created, for further rabies transmission from one dog to another. And that concept is well proven and well established in many countries and many areas that has been declared rabies free. And just adding to what Anil said, there is to include all the bodies as intersectoral coordination, national program for rabies control that is already there, and NEPRE is already established. State plans are being made to include all these bodies to achieve the objective of rabies, human rabies free India by 2030 as emphasized by WHO.
Thank you, Dr. Omesh. I think what I'll do is, if each of you, since all the four speakers have given 4 different perspectives, can each of you just give us one opportunity or one aspect that you feel should be the most priority? Because I think so I would like to collate all those things and see, because one is coming from field, one is coming, Dr. Omesh is coming from a very hardcore evidence-based guideline. Dr. Chanchal is coming from government experience and implementation at a much public scale, and Dr. Ganesh is also coming from a very immunological laboratory linking to antibiotic microbial resistance and the whole pharmacological One Health Connect. So can each of you just give one point where you feel is important to manage or to handle One Health in India in future? Dr. Chanchal first, please.
In my opinion, in respect of rabies, if I am talking in respect of rabies, if I am considering Delhi, because I'm working there in Delhi, we need to implement a mission mode action there. And we need sufficient fund, what Dr. Anil has told, because we have scarcity of funds and we have scarcity of manpower also. But if we are implementing a mission mode, then I think that up to some extent we'll be able to solve this problem.
Thank you. Dr. Anil, just one point which is most priority for you.
So for me, as I discussed in my presentation, if we go for service dog vaccination in India, not in Himachal, in India, we'll be able to say in future that we have controlled rabies up to some extent.
Thank you, Dr. Anil. Can I go to Dr. Ganesh? One point, sir. What do you feel is important to manage One Health and its future in India?
Yeah, what I feel is we should increase the awareness, education, public health education in nook and corner involving the universities. We have plenty of people now. The people are participating. Swachh Bharat, Mera Gaon, Mera Gaurav. Such programs should be plenty. I mean, it should be this. The size and quantity of programs should be increased so that people can be aware of the diseases. See, in our own locality, people don't know what is rabies, and many people don't know the complete extent, how it is transmitted, what are the precautions they have to take. Suppose that is achieved, like in around you, and then villages and group of villages, that will be a best point. Next thing, I feel professionals also, they should be educated to have a One Health program. See, I prefer having a PG, a PhD programs in One Health, so that the interdisciplinary professionals, they can come together and develop. And collaborative research with the same disease, if you are working towards the human and animal aspects, that will help.
Thank you. And final say, Dr. Omesh, what do you feel according to you is the most priority for One Health in India?
I think One Health is considered as only human health and animal health and environment health. I would say One Health should include another aspect is that is interdepartmental collaboration. Because if as a epidemiologist, I'm telling municipal corporation that there is impeding jaundice outbreak, so they are not taking my thing seriously because they have their own health officer. So I think that is another area that is lacking in not only in India but in other countries also. The interdepartmental collaboration to achieve human, animal, and environmental health, that should be the key word. So that is what I want to say. And I want to say that after this COVID, One Health has become a buzzword, and in India, the Honorable Prime Minister has also opened a One Health Institute in Nagpur. And NCDC mandate is also there on One Health. Only thing is we need leaders in all the states to take forward the NCDC mandate and Government of India mandate of taking forward this One Health into a practical shape. That is what I think. Thank you.
Thank you. Thank you. I think just to summarize what the four speakers, mission mode, which brings more funds, surveillance-based mass dose vaccination. Third is awareness among populations, among people as well as professionals regarding One Health, including both public awareness campaign, but also formal training. And lastly, interdepartment collaboration. So I think these are good takeaways from this webinar. I thank all the speakers for taking their time off for giving their valuable wisdom. Also to all the participants, I apologize again for the delay in technical glitches that happened. And I'm thankful that each of you took the patience of sitting with us for the last 2 hours. To all of you have registered, some of you have asked for the presentations. We have the presentations and we will send each of you, we'll put it on a Google Drive and send the link to each of the participants who have registered with us and whose email is available with us. Thank you once again. Thank you. Yeah, thank you, Dr. Ganesh. Thank you, Dr. Anil. Thank you, Dr. Omesh and participants.